Jones?
Yes.
Hi, my name is Brittany. I'm going to be your nurse today.
Okay.
Let me just wash my hands really quick. Alright, can you verify your first and last name for me?
Yes, Tracy Jones.
Good, and your date of birth?
September 1465.
And your MR number? Do you happen to know that one?
No.
Okay, it looks like it's 0223351. Alright, do you have any allergies?
I do.
Okay. What, to what?
I get sensitive to gloves, the
Latex gloves? Okay, gotcha. Okay. Do you have any other allergies to medications or food?
No.
No. How about taper, like just environmental allergies?
No, just seasonal.
Okay. Well, again, my name is Brittany. I'm going to be your nurse today. Is it okay if I do a quick assessment on you and make sure everything's okay?
Sure.
Do you know where you are?
Yes, I'm at University Community?
Yes.
Okay.
Yes. Very good. Do you know what year we are in?
This is this is 2016.
Okay, good, good. It looks like you have a little IV line right here. They're giving you some fluids.
Yes.
Yeah, okay. It looks like it's going okay. There's no redness here. It's not swollen. I don't see any signs of infiltration, no bruising or anything. Is it hurt at all when I was touching it?
Not at all.
No? Awesome, okay. So it looks like you've been laying down a lot. Can you turn your head for me? Awesome. Yes, I don't see any breakdown here. You have any soreness?
No.
No, good. Okay. Well, you can go ahead and lay back down. Your skin is nice and warm. You have good skin turgor here. All right. Your fingertips feel nice and warm too. They don't feel tingly or anything?
No.
Awesome. I'm going to go ahead and check your pulses. Good. They both feel equal. They both feel normal. Awesome. Alright, so we're just going to go ahead and head into the next part of the assessment. So next I'm going to be assessing your ears and your eyes and making sure that your breathing and your heart is okay, alright? Okay. So I'm just going to take a look into your ears, make sure that there's nothing coming out. Everything looks good. They're nice and warm. Alright. And then I'm going to have you look up at my forehead right here. I'm going to check your pupils, okay? Good. Pupils are reacting to light and they're both equal and they're round. Alright, so next I'm going to check for your nose. I know it might be a little awkward, but make sure that things are nice and pink. Good. There's no breakdown or anything. And then I'm going to check your mouth just to see if there's any sores, okay? Good. Nice and pink mucous membranes. And can you smile? Awesome. Show me your teeth. Good. Beautiful. Nice and symmetrical. Okay, so next I'm going to do a respiratory assessment on you. Are you having any trouble breathing at all?
No.
No? You don't have any chest pain?
No.
No? You feel good? Okay. I don't see any accessory muscle use at all in her diaphragm or in her lungs or around her rib cages at all. Her respirations are quiet and labored and they appear regular. I'm just going to take a listen to your breath sounds, okay? Can you sit up for me? Alright, so I'm going to go ahead and listen to your lung sounds, okay? Can you take a deep breath for me? Good. Very good. Alright. Let's go ahead and have you lay back down. Great job. Alright. So you have a couple, lung sounds good, sounded clear. They sound great. Next I'm going to check your carotid pulse, okay? It's up here right by your neck. Good. I don't feel any bruise or I don't feel the thrill at all. So I'm going to check and listen to it, see if I hear a brewery at all. I don't hear any breweries. So one thing that's really important for when you're laying in bed is to use the incentive spirometer. And so I would demonstrate, the proper use of the incentive spirometer and how to use it. Another thing that I would like to do is go along and assess her pulses. I already assessed her radial pulses. I'm just going to go ahead and do it a second time, just like her. Pedal pulses feel good too. They feel normal. They're non-bounding. Next, I'm going to listen to your heart sounds, okay? Before I do that, I'm just going to palpate your point of maximum impulse right here. It's at the fifth intercostal space, the midclavicular line, and I don't feel any lifts or heaves at all. Okay, so next we're going to go ahead and listen to your heart sounds, okay? Can I have you sit up? Awesome. Thank you very much. All right. So first I'm going to be, actually, while she's sitting up, I'm going to assess her carotid arteries still, and they still look great. There's no thrill. I don't feel any thrill at all. It feels normal, and I don't see any neck vein distension at all. I'm going to go ahead and listen to it while she's sitting also. Good, no burp. Alright, so I'm just going to listen to your heart, okay? I'm going to start at the right sternal border, at the second intercostal space. Wonderful. So I'm going to move to the left sternal border, second intercostal space. Sounds normal. Next I'm going to move to the Erb's point at the left sternal border, third intercostal space. And then I'm going to move to the tricuspid. It's at the left sternal border, the fourth intercostal space. And next it's going to be at the fifth intercostal border, at the midclavicular line. And everything sounds great. And while she's sitting up, I'm also going to see if there's any heaves or lifts at her point of maximum impulse, which I don't feel any. Okay. Now you can go ahead and lay back down. And that's all for cardio. Okay, so next I'm going to be assessing your stomach, just to make sure that all your bowels are doing okay. So, have you had any nausea or vomiting?
No.
No? Okay. How about diarrhea at all?
No.
No?
My stools are good.
Good. When was your last bowel movement?
Just yesterday.
So I'm just going to go ahead and take a look at your stomach, if that's okay.
Mm-hmm.
Yeah? Okay. So your tummy looks normal. It's warm. It's symmetrical, and I don't see any obvious pulsations at all. I'm first going to listen to your stomach, and then I'm going to palpate it just to see if there's any hardness in any areas. So I'm going to go ahead and listen to each quadrant, and I would listen to it for 5 minutes if I didn't hear any bowel sounds at all. Next I'm going to palpate your stomach. It's nice and soft. I'm going to palpate each quadrant. Do you have any pain? No? Okay, so I'm going to do some deep palpation. Okay. I'm going to check your liver. I don't feel any hard nodules there. Any pain at all?
No.
And how about here? No? Good. Alright, so her stomach is soft. There was no abnormalities in any hard areas. Have you been urinating more frequently than usual?
No, urinating just fine.
Okay, how many times a day on average do you urinate?
I'd say pretty much 6 to 8 times a day.
Good, okay. And when was the last time you urinated?
Probably an hour ago.
An hour ago, okay. Do you have any pain on urination at all?
Not at all.
Okay. While she's in the hospital, I'll make sure to monitor her intake and output. I would like to just assess your neurovascular system. By doing this, I'm just going to have you squeeze my hands really tight as you can. Good. They both feel equal and strong. I don't notice any swelling at all in her hands. Do you have any tingling, numbness at all? No? Okay. So next next I'm going to assess your feet. I don't see any swelling or tinglingness, or I don't see any swelling at all in her legs. And again, as noted earlier, her pulses were great in her feet, her fetal pulses. Now if you can go ahead and just lift up your feet. Good. It's both symmetrical and strength. And I'm going to have you push down. Good. Both symmetrical and strength also. She was able to move against resistance, which was great also. So this completes my exam. Do you have any questions?
No, what do you think I'll be getting out of here?
That's a really good question. I'll go check to see if the doctor has put in any new orders, okay?
Okay, great.
I'll make sure that the call light is in reach, side wheels are up, and if there's nothing else I can get for you, just give me a call on that call light. The red button indicates me. Okay?
Thank you.
Alright, so I'm going to go wash my hands and leave the room. And that concludes my assessment.